Hi everybody, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. I've been asked so many times in the last 2 days to do a short video on postural orthostatic tachycardic syndrome, also known as POTS, that I thought I would discuss first how the diagnosis is made to try and clear up any confusion which results in an incorrect diagnosis, because it seems like so many people on TikTok have been told they have this diagnosis, and I find it hard to believe. So POTS is a disorder characterized by orthostatic intolerance. Believe it or not, we removed the term orthostatic in the name of the condition due to the overlap with other disease entities because it's been causing confusion. So orthostatic intolerance describes an abnormal autonomic response which causes symptoms that develop while sustaining an upright posture. The symptoms include lightheadedness, dizziness, blurring or fading of vision, generalized weakness, fatigue, palpitations, mental clouding, anxiety, nausea, shortness of breath, or headache. So the incidence of POTS is not precisely established, but the prevalence, which means the people living with it, is estimated to be approximately 0.2 to 1% in the general population, with a marked female preponderance and a peak onset between ages 15 and 25. So here's how the diagnosis of POTS is made. First thing, a history of symptoms of orthostatic intolerance with or without systemic, which means total body symptoms. 2, a correlation of symptoms with a sustained increase in a heart rate when standing by at least 30 beats per minute or 40 beats per minute for the patient under the age of 20 years of age within 10 minutes of standing, okay? The third thing is autonomic testing to correlate symptoms with heart rate changes, confirm the diagnosis, and assess the degree of objective signs of orthostatic intolerance. And fourth, other diagnostic testing needed to exclude alternative diagnosis or confounding concomitant conditions. The key physical finding is an excessive rise in resting heart rate within 10 minutes of standing without a decrease in blood pressure. That is key, without a decrease in blood pressure. Autonomic testing is useful in the diagnosis of POTS in patients with orthostatic intolerance symptoms and for a reassessment of changing symptoms over time. Autonomic testing is more sensitive and specific than random sampling of heart rate during clinical bedside assessment while standing. So how do we do the testing? Well, it includes tilt table testing and pseudomotor testing. Pseudomotor testing should be performed as a routine component of formal autonomic testing when available. Approximately half of POTS patients will have neuropathic abnormalities evident by pseudomotor testing. Now, should somebody have laboratory tests? Well, they're only useful to exclude other causes of orthostatic intolerance symptoms, because orthostatic intolerance and systemic symptoms are not specific to POTS. So we perform routine testing in the initial diagnostic evaluation in patients, and this includes just measuring your normal electrolytes, a complete blood cell count, thyroid function testing, and electrocardiogram. I will cover this topic more in detail in another video, but what is most important is to make an accurate diagnosis, because you don't want to be labeled with something that you don't have. And from what I've seen, as I said earlier on TikTok, there's a lot of misinformation. So with that, I hope everybody learned something today. Thank you for listening, and I hope you have a great day.